Been your experience watching this entire coronavirus situation unfold, the way the World Health Organization has handled it, the White House response, all the way down to local and state governments and around the world?
Well, there's a couple parts to that, Spiro. When it very first started happening, so I'm going to say this was around maybe the second week in March. When they really, because when this really started building up and all the hype and everything. I mean, I pulled up and went to the CDC website and I started researching coronaviruses. And I said, what's the big deal about this? I mean, there's 36 known coronaviruses. 7 of them can cause illness in humans. 4 of the 7 are very common, and that in any given annual flu season, influenza by definition needs to be caused by an influenza virus. So if it's not caused by influenza virus, the other 85% of illness that's out there, because only 15% of illness any given year of flu illness is actually caused by influenza viruses. So 85% is caused by something else, and they call it an influenza-like illness. Of that 85% of illness, almost 40% of it, on an annualized basis, is caused by a coronavirus. So I'm like, this is just a flu virus. I mean, what's happening? I mean, what is the big deal about this? And then as it went a little bit deeper and I started seeing what they were talking about with shutdowns and this and that and keeping people inside, I've been telling people from nearly the beginning of this that this has nothing to do with this virus, and just watch. Mark my words that in a few weeks they're going to start crunching the numbers. And anybody with a phone these days is a citizen journalist. We're going to see lots of lies that are going to be coming out from this. This is economic warfare. This is going after Trump, doing anything they can to crash the economy, to do whatever they need to do about derailing our next election. So we have to send in ballots or do something electronically, like nothing can go wrong there. I mean, look what happened in Iowa, the one time that they tried it and it didn't really work. This is about economic warfare, probably at some level that is way above my pay grade of what's going on with China and the US and Russia and who knows what else is kind of going on. But it was never about the virus. Never. And I still believe it's not about the virus. I mean, when you've got 80 to 86% of people who actually contract the coronavirus illness completely recover or aren't even sick enough to go to the doctor. We've got empty hospital beds. We're laying off doctors and nurses. We're shutting down global economies. We're decimating entire industries like airlines and the cruise industry and the travel industry and hotel industry, the restaurant industry, hashtag I need a haircut, right? And so, we're decimating industry over what? And we're social isolation. That when they started using the term social distancing, the first time I heard it, I was in my office with we were sitting in the back room having lunch, and I said, do you guys see the psyop that's going on with just that phrase? The psychological social distancing? They didn't say, we've done an experiment and we feel that staying 6 feet apart from somebody when they sneeze or cough is probably a good idea because, they may sneeze or cough and we don't really know how far the virus travels. So if you see somebody who's sick, they should stay home. And number 2, if people are coughing, you should probably maintain a safe distance. No, it's social distancing. That's now part of our language lexicon and maybe part of our society for a long time. And wearing these masks and gloves while they're, I put up a meme the other day and it said, the U.S. government tracks everything. And it had a gal with a black mask and black gloves like this. I said, who's tracking the robberies? Because, we don't have facial recognition, we don't have fingerprints, and we're letting all these people out of jail. I mean, who's tracking robberies, So as I've watched this, it infuriates me. I'm so glad that finally it's sort of like this tsunami. Everybody was like, and now people are going, and they're getting mad. I'm glad. And they're saying, screw you, I'm going back to work. I am not going to let the U.S. government and my governor, who's never written a paycheck for employees probably in his entire life and laid off families and are about to make people homeless. I'm not going to let the government take away my house, repossess my car, ruin my credit score that I've worked so hard to build, make me default on my credit cards for a big fat nothing burger virus. I can't believe that more people aren't responding and saying, no, I'm done. I'm going back to work.
I think it's getting to that point. We are beginning to see more and more people start to resist the lockdowns. More and more people are starting to just go and open up their businesses. I know people that are saying, "Screw it, I've had enough. We're opening up for business," and that's just a form of civil disobedience. And as you correctly pointed out, they're literally releasing criminals from jail. Some of which are sexual offenders. Very dangerous.
Murderers.
Yes, very dangerous
They let
people.
out like 22 murderers out of jail the other day. Convicted murderers.
Unbelievable. But at the same time, they're threatening imprisonment of just regular people who are not criminals, who just want to work, who want to live their lives.
And in New Jersey, they're now using drones on the street to fly over to make sure that nobody's out there unnecessarily. I've gotten things, and you probably have too, about these downloaded apps that are automatically downloaded on your phone. These distancing apps that send you. I got screenshots from people that have sent them to me that says, you're 10 kilometers away from your house. Why aren't you Why aren't you staying home? Why aren't you quarantining? Being in lockdown, actually being under house arrest. You call this number in the next 15 minutes to explain your whereabouts.
Unbelievable. Wow. We have seen, big tech is partnering with the government to roll these, this is, the surveillance is just mind-blowing. It's been growing and growing and growing. 9/11 justified so many things as far as the never-ending wars, the police state, the surveillance state, and this is like another 9/11, like a global 9/11, to where now we're ending one paradigm and transitioning into a new system of control, a new digitalized system of control. Now, Dr. Tenpenny, recently we have seen Dr. Deborah Birx of the White House Coronavirus Task Force openly admitting that they are inflating the death numbers. And we've seen major problems with the testing, including reported contamination of tests. What are some of the possible factors which would contribute to, for example, a false positive of the test? And what are they actually testing for? Are these PCR tests testing for COVID-19 specifically?
That is the $64,000 question, isn't it? It's probably the 1.2 trillion. It's the $3 trillion question, actually. What the heck are they testing for? And I said that from the very, very, very beginning when they said, well, everybody's got to get tested. What are they testing for? If there are 36 known coronaviruses that have been around for 6 decades, for 60 years, these viruses have been known and been typed. And it's an RNA virus, so each time it goes through somebody and somebody gets sick, it morphs into a new subtype. What are they testing for? Are they testing for the fact that you had coronavirus influenza-like illness 7 years ago, and now you have an antibody to that? Is that what they're finding? Are they specifically looking for the SARS-CoV-2 antibody? Has it been around long enough for anybody to do that? We know there are at least 30 substrains of that virus. I mean, we keep talking about the virus, like there is one, like there's like the virus, right? When we know that from the beginning, the Wuhan virus outbreak, whatever it was different than what was happening in Iran, different than what was happening in Italy, different than New York, different than California. And even the New York Times ran an article, I think last week, that said they know there's at least 30 of subtypes of this family, of this particular virus already. I mean, they're already talking about it. So what are we testing for? And we're testing superficial swabs, gag people to death with posterior throat swabs. We're doing fecal swabs. We're doing poke the finger antibodies, and we're either getting, if you get an IgG antibody, does that mean you're currently sick and you're recovered, or does that mean that you had an IgG antibody from the virus that you had 17 years ago? What does that mean? And if you have an IgM antibody and you are completely asymptomatic, does that mean you're infected and you might be like Typhoid Mary spreading stuff around or something? And they mixed all that data together. They threw it all in a pot. So none of it has any validity, none of it. And since we don't know what the true denominator is, we have no understanding about incidence and prevalence, and we have no idea. The death rate is absolutely irrelevant. I mean, I think somebody sent me a really interesting document yesterday. It was like a little screenshot. Let me see if I could pull it up here really quick. This is directly from the CDC. Here it is. And it says, this was the provisional death counts from coronavirus from February 1st through April the 11th. the number of deaths that were actually with the actual code, deaths confirmed, not being associated with, but confirmed by having COVID-19, which is the condition, 11,300. This is the whole country, 11,356. Now, how many people died of pneumonia, influenza, and maybe COVID was 54,200. How many deaths from everything else in that time frame from February 1st to April 11th? Almost 569,400. So if you combine the known COVID-19 deaths, 11,300, and the pneumonia, influenza, and maybe COVID with the 54,000, you're ending up with 65,000 deaths from February 1st to April the 11th. 65,000 deaths, which is less than 10% of all known kinds of death. But yet we are shutting down the whole world over this. I mean, it just makes me insane. In fact, I've gotten really angry about the whole thing. It's like I've gone from kind of sitting back, because the first time I sort of sat back and gone, what is